You know, women carry a lot of stress, and believe it or not, they often carry that stress in their jaw, of all places. Dr. Adam McCormick is an oral and maxillofacial surgeon who treats patients with TMJ, a condition that can bring on headaches and other facial pain. We've heard about this, Dr. McCormick. Tell us what it is exactly.
So a lot of people that have this issue present with an earache. It's kind of interesting because they'll go to their primary care doctor or an ENT and they'll say, I have an ear infection, and they'll look at them and say, your ear's fine. You have TMJ. Well, TMJ is just a term for the joint itself. It's like saying I have knee or I have shoulder. But what's interesting is it's the joint that we use the most in our body. And so it makes sense that it can be sore, and it can range from jaw pain to neck pain to shoulder pain. Yeah,
the ear surprised me. So it can extend really down the whole side of the head, that pain that you're experiencing. So if women are saying tension headaches, that could be another symptom of this?
For sure. And what's interesting too is most women, well, the most commonly affected group are women from the ages of 20 to 40. And so we see it fairly often. And it's a treatable problem.
Before we get into treatments, how do you go about diagnosing this?
Most of the time, patients have to come in and we listen to them and find out what their history is. And we do a physical exam on them and see what's going on. Sometimes we have to get imaging to find out if there's any arthritis or anything going on with the disc.
All right, and treatments, you say there are a range of treatment options available.
Most commonly, patients, if you're suffering from this, a soft diet for a couple weeks is very helpful.
Just to relax,
give it a break. Exactly. Anti-inflammatories such as ibuprofen work really well. And then the other treatments that we can do are Botox, which is a muscle relaxant that we can inject into the muscles that help relax.
Now hold on, this has nothing to do with wrinkles or anti-aging. What does the Botox do that kind of frees up the muscles in that way?
It just relaxes the muscles so that they can just give some time to recover. And it works really well. It lasts 6 to 9 months, and most of the time people only have to get one injection and they're done.
Interesting. You hear about sometimes people who clench their jaw when they sleep. Does that contribute to this as well?
It does.
Any solutions for that?
There are some bite splints that can be made for those kind of situations, but most of the time people do really well with just conservative therapy. But there are other options that come into play if they don't respond to those therapies, such as a joint flush out or even surgery. But most of the time people don't have to have that done.
What does that entail, a joint flush out?
That's where we put the patient to sleep. We put a couple ports into the joint. It's just like having a knee scope or a shoulder scope. Flush the joint out, get all the inflammation out of there, and put a steroid in there.
Interesting. And in advanced cases, rare as you point out, but in advanced cases you can treat it through a surgery.
For sure, and those patients are fairly rare, and those are typically arthritis that cause disc degeneration. So, for example, the disc in between the bones becomes so worn down that it needs to either come out or it needs to be repositioned. In rare cases, we actually have to do a joint replacement.
Gosh, this hasn't been a personal problem, but I had a couple of instances where my jaw locked up. Painful, annoying, I mean, the list goes on. So if people have questions or concerns surrounding this condition, how can they get in touch with you?
Just go to our website at omsofutah.com.
And where are you located?
We're in Bountiful, Layton, Ogden, and Pleasant View.
All right, thank you so much, and thanks for bringing your friend.
Yeah, absolutely.
He's staring right at me. All right, we'll link you over to that website from our website to make it easy, studio5.ksl.com too.